Hey there, welcome to this week's episode of Next Level Play Therapy. For those of you watching the live stream on YouTube or Instagram or on my LinkedIn channel, you'll probably notice today is a different time. Same day, just different time. I usually hit the live button much earlier in the day. But I've been going to this really awesome training, which really fits in well with the topic. So that worked out really nice. Anyway, so I've been going to this training during the day. It's called Diagnostic Classifications for 0 to 5. So I'd be curious how many of you guys have gotten the DC 0 to 5 training for infants and early childhood. Go ahead and post that in the comments. I would love to see who's got that training. It's really good. And the reason I thought it was relevant for the conversation that I want to have today is it talks about the 0 to 5 diagnostic classifications is all about gathering enough information to get a really thorough understanding of what's going on with your clients. And to me, that means we're also talking about case conceptualization. And does taking that time at the very beginning of the treatment process, is it worth it? Is it worth it to take that time? Because I know a lot of mental health professionals and a lot of play therapists feel like they don't really need to do that. They just want to get right into helping their clients. And I definitely understand that intent. However, I think it's really important to do that information gathering so you have more of a depth of understanding for what's going on with your clients. So that's what I want to talk about today. What are the benefits to you, but what are the benefits to your client of taking that time to formulate your case conceptualization? And what the heck is case conceptualization? Some of you guys might be kind of thinking, that term sounds really familiar. I think I learned about that in grad school. So might be back there in kind of the cobwebs of your mind. And today will be a good day to dust off those cobwebs and have a conversation about that and how it can benefit your clients. So if you're watching on the live stream here on Instagram or YouTube or LinkedIn, I would love to know who's here. Post your name in the comments. Where are you from? What population do you work with? Do you have questions? I'd love to hear your questions, or feel free to comment during the live stream episode. And the only thing that I ask, if you're posting during the live stream, or even if you're watching the replay, the only thing that I ask is not to post information or questions about specific clients, because it is a public format and we do want to make sure to be mindful of privacy issues. For those of you listening on the podcast, I would still love to hear your comments. Feel free to email me, post your comments, and let's get started for today. First of all, let's define. So today what we're talking about is, how does good case conceptualization benefit play therapy clients? First of all, let's define what case conceptualization is, because it's a really fancy term, and just making sure we're all kind of on the same page about that. Case conceptualization is really that process you go through to take that information that you've gathered, all of the details about the symptoms that your clients are presenting. You're exploring history, maybe family history, school history, developmental history, gathering information about all kinds of things going on in their lives. How are they doing? To give you a better idea of your client and their family system and how those things all influence your client and what's going on in their current life. So all of those questions that you're asking, and to gather that information, you're going to take that information to formulate your case conceptualization, which essentially is what's at the root of the problem, like what is going on that's activating that behavior, and then also identifying all of those patterns that are going on in your clients' lives that are sustaining and maintaining those symptoms. So that's essentially what case conceptualization is. I look at case conceptualization as being a good clinical detective. I love a good mystery, a good detective story. That's what I do in my off time to kind of clear my brain. But I love that idea of figuring out, collecting all the clues to figure out the mystery. And the mystery is, what the heck is going on with my client? So it's kind of like you go into clinical detective mode to figure out the clues to better understand what's going on with your client and why are these things happening. I always kind of look at it also, that analogy of like going to the doctor's office, because a lot of times what I'll hear from play therapists is they feel like if they ask a lot of questions, it'll make their clients uncomfortable, and it'll feel like they're not really getting started, like the reason they're coming is for the change process. Plus they worry about asking all of those questions, that it might be kind of uncomfortable for their clients. And that is a valid point. So you have to be careful how you ask the questions and be mindful of that it might activate your clients or parents, right? Because typically when I'm doing that diagnostic assessment, typically I don't have the child present at that very first session because I really want to have some privacy to gather all of that information. That being said, I have to be mindful of this is their parent and this is challenging for them as well. So I want to be mindful how I ask the questions, but I still want to ask the questions because I'm not going to find out really what are at the roots of the problem unless I ask the question. So a lot of times that's the reason play therapists don't want to ask the questions. And I like to use the analogy of how many of you have ever gone to the doctor, or maybe you've taken your kids to the doctor. Like my kids are older. But I remember when they were little, especially my first child, I don't know anything. And I want to be a good mom and I want to make sure all their health things are good. And if they get sick, I don't know what, I haven't been through this before. I want to make sure that they get the best care. So how many of you have gone to the doctor maybe when your kids were little and the doctor only asked one or two questions and then wrote a script? Well, in my mind, I'm like, does that really instill confidence that they've gotten the right thing, especially if you have to go back once or twice, right? But when the doctor really starts asking a lot of questions, because I don't know, I'm the parent, I don't know what questions they need to be asking me. In my mind, I'm relying on the doctor to know what questions they need to ask so they can figure out what's going on with my child. And when they start asking questions and it lines up with what's going on with my client, then I'm going to feel more confident that my doctor actually knows what's going on. And the more questions the doctor asked when my kids were little, the more confident I felt that the doctor was really intent on figuring out what was going on. Well, that's the same way in mental health. When we're asking questions to get to the really the heart of what's going on with clients, I always tell people that I supervise, and I talk about this all the time in Play Therapy Academy. So if you're interested, Play Therapy Academy is my online play therapy consultation program. I'll talk about it a little bit at the end because they do currently have openings. I don't intend, I don't anticipate those are going to last very long, but I do have openings, so I'll talk about that. And so in Play Therapy Academy, we meet for online group consultation meetings. There are some courses in there. We have a group chat. One of the things that comes up a lot, and I talk to people about all the time, is when you're talking about symptoms, you want to think frequency, intensity, and duration. Like I have people, I kind of drill it into their heads a little bit, like frequency, intensity, and duration, frequency, intensity, and duration. If you're asking about symptoms, ask frequency, intensity, and duration. That is such a critical part of that information gathering, because your case conceptualization it could be like the difference between going right and going left. If you don't have all that information, it will influence your case conceptualization because you may not have all of the information that you need. So I know people worry about asking too many questions, taking too much time, and not getting into the healing part, the play therapy sessions. But I think it's a mistake because you miss it a lot. And one of the things that comes up all the time when I'm talking to people, and we have these conversations in Play Therapy Academy, and I've had people in there for a long time and new people coming in. I think at this point, they kind of know Kathy's going to ask, did you do your information gathering? So they already know to give me those answers, and they already know that it's a really important part of the process. And if you don't take that time, then your case conceptualization may not be as accurate as possible. So that said, we want to do that information gathering at the very first session, or maybe you're in an agency where you take 2 to 3 or even 4 sessions for all that assessment gathering. We also know that assessment is ongoing throughout the treatment process. So assessment really, in my mind, never really stops throughout the play therapy process. And then we're kind of always taking in new information and seeing how that lines up with our initial case conceptualization. So it's both ongoing, and you really want to take that time at the beginning to formulate your clinical case conceptualization. The other thing is your case conceptualization is going to be influenced by your play therapy model. So theory drives application. That's what I say all the time. Theory drives application, meaning your theoretical model is going to influence how you make sense of what the problem is and why the problem is happening. So, for example, the way child-centered play therapy would conceptualize the problem and why it's happening will be different than maybe Adlerian play therapy would conceptualize the problem and why it's happening. There's probably some overlap, and those different theoretical models are going to conceptualize it differently. Even if you're using an integrative play therapy model, which a lot of people do, including myself, I would say my foundational theoretical model that I operate out of is attachment and neuroscience. And so in my mind, child-centered play therapy, which is a model that I like using with the young kids. So if they're young, I'm going to use child-centered play therapy. even with child-centered play therapy, I will kind of conceptualize using that neuroscience and attachment lens. With older kids, when I'm using a more integrative model, I'm still conceptualizing it that way. And the thing about good case conceptualization is it's going to help you figure out what the problem is and why is it happening. Because in order to answer the question of how do I help my clients, you really need to understand what's activating the symptoms, what's going on with those symptoms, and why are they happening? What are those patterns that are going on? So that when you're doing that treatment planning process, and you'll have an idea where you need to target things. So usually, you do consultation. The question is, how do I help my clients? Well, in order to really understand how to help your clients, you really need to understand first what's going on with them, which brings me to the next point for today, which is what are the benefits to your clients? If you're going to take that time to gather all the information and you're going to, hold off on actually doing the treatment implementation in the sessions, then I think it's always important to understand, well, how is this going to benefit my clients, right? That's what we all want to know. We want to make sure that whatever we're doing, we're helping our clients. So the benefit to your client is if you have a better idea of what's going on with them, then you're going to be able to help them get better. Your ability to get better treatment outcomes sooner, it greatly increases because you're able to target the right areas, especially if you're using a play therapy model where you can sometimes lead. Maybe you'll lead sometimes, maybe the client leads. Even with child-centered play therapy, because if you're using child-centered play therapy, you're not leading, right? That you're always following. Child-centered play therapy is the therapist follows. That being said, if you have a good case conceptualization, then in the sessions when you're following and you're doing your tracking and you're recognizing the themes, you're kind of seeing where that fits in with your case conceptualization. And it can help you with your tracking statements and making sure that you're reflecting maybe some of those things that are going on in the session and maybe be a little more targeted with what you're reflecting. So I would say good case conceptualization, regardless of what play therapy model you're using, can help you target the right areas more accurately to get better treatment outcomes for your client, because you're going to have a better idea what's going on with them. And then throughout the change process for play therapy, you're just going to continue that assessment process and kind of fine tune and hone your case conceptualization for your client throughout the change process. The benefit for play therapists, and to me, this is a big one, and I find this one a lot because these are the things that we really target in Play Therapy Academy, is how do you develop your play therapy competency skills to be the best version of you as a play therapist, so you feel like you are making a difference in the lives of your clients, right? That's why we get into this field. We want to make a difference. We want to help our clients. We want to be a positive influence in their lives. Well, if you have a better idea what's going on, then you're going to feel like you're making more of a difference in their life because you feel more confident in your skills. So the Association for Play Therapy here in the United States has identified core competencies for play therapists. So if you go on their website, which is the Association for Play Therapy, then you could do a search. They have the core competencies on there if you want to take a better look at those. So I'm going to read the core competency that is relevant for this discussion about case conceptualization. And it is competency 2. The category is competency 2, clinical play therapy skills. And so this is 2C, which says apply assessments that highlight various aspects of the child and or system and the play therapy process. For example, conceptualization, diagnosis, family dynamics, treatment suitability and effectiveness, and termination. So that whole case conceptualization is then going to give you an idea for your treatment planning. What do we need to focus on in the treatment process? And your treatment plan is essentially your roadmap. Here's what we're going to do. Here's our roadmap. Here's the framework that we're going to use. Here are all the things that we want to target in order to improve the situation that's going on for your client, in order to have what I believe is a useful and effective treatment plan that you feel like you're actually able to use, rather than just to appease the documentation gods. And then you're like, no, check that box off. I never use it again. I mean, to me, a treatment plan can be a really useful tool. In order to have that useful tool, you have to really understand what the problem is, and that's your case conceptualization. So that's the other benefit for play therapists, is having a good starting point and helping you figure out what needs to go in the treatment plan. And to me, the other benefit is something that we don't talk about very much. I talk about it pretty regularly on my live stream and the podcast, which is imposter syndrome. Imposter syndrome is feeling like you don't know what you're doing, and you have this dread and fear and terror that any day now your clients' parents are going to figure out that you're a big giant fraud and that you don't actually know what you're doing and you're wasting their time and money. That your imposter syndrome has gotten activated if those thoughts pop up in your head. To me, part of developing those competencies for play therapy is making sure your imposter syndrome goes away and you can tell it the truth, which is you are doing a good job. You do know what you're doing, and you are able to help their client and make a difference in their lives. So we talk about this a lot in Play Therapy Academy, doing that skill development, helping you develop your confidence and your skills. The more you develop your skills, the more confidence you have, right? And then you go try it out with your clients and you see that it actually works. You see how to actually apply the play therapy model from session to session to session with various clients, with various presenting problems, right? Your confidence grows, and now you're also focused on honing those case conceptualization skills. So that is it for today. Let me just do a quick recap for today. One is defining case conceptualization. And I like to think of that very first session as an opportunity to gather as much information as possible so I can get a really good sense of what is going on with my clients, and to know how to support them and their parents. In order to do that, I need to be a really good clinical case detective, meaning I need to ask all the questions, gather all the information, use that information to formulate my understanding of what is going on with my clients and what patterns, what are the things going on in their lives that are sustaining this and creating the problem. So that's a fancy way of saying, that's case conceptualization is a fancy way of saying that in 2 words or less. The benefit of for clients is if you take that time to do that thorough assessment, to do your case conceptualization, another word is case formulation, clinical case conceptualization. They're all kind of the same thing. If you take that time to gather all of that information and formulate your case conceptualization, now you have a good starting point to understand and identify the best way to help them. So for your clients, you're actually targeting what's really going on and tuning into what are all of the factors that are at play that are contributing this so that those can be targeted during the treatment change process, and your clients can actually get better in the quickest amount of time as possible. So that doesn't always mean 12 sessions or less. A lot of times it's, I don't know, for you guys, I find most of my clients, I see them for at least a year. I see pretty complex clients a lot of times too, so it's usually longer than that. And it's still beneficial to have an idea where you're going and what needs to happen in that change process. And in order to do that, you need to understand what's going on with them. So the benefit, that's the benefit your clients. The benefit for play therapists is you're developing your skills, you're feeling more confident in your abilities, you're feeling good that you're making a difference in the lives of your clients because you have taken the time to gather all of that information, and you're now seeing how that information is beneficial for you to help your clients in the most effective way in the change process. And the byproduct of this, the added bonus, is your imposter syndrome begins to go away, because now you have a better idea of what's going on with your clients and you feel like you're making a difference, and that helps you feel good, which is why we do this in the first place, right? We want to help make a difference in the lives of our clients. So that is it for today. If you're interested in Play Therapy Academy, I do have some openings. I have 3 openings. I might have 4 in 2025, but for now, I have 3 openings. I have 1 opening in my Saturday group and 2 openings in my Wednesday group. In Play Therapy Academy, we meet twice a month. We have a whole structure for case presentation. There's dedicated time for you to get feedback on your clients because we have a schedule of who's presenting. That way you know you get time. And we have dedicated time to support you. The other thing is, though, because it's group, you're not only getting my feedback, you're getting all the feedback from the amazing other play therapists in the group. And we have 2 really amazing groups. And oftentimes, people will give feedback that I hadn't thought of in the moment, and it's such really good feedback. So it's really nice. You not only get my 30 plus years, you really get the wisdom of the group and all their experiences and expertise. So I feel like it's a really richer learning environment. Also in Play Therapy Academy program are some online courses, one of which is Getting Grounded in Play Therapy Case Conceptualization, which is kind of what we're talking about today. So there are online courses to help you learn the skills, and then you go apply those with your clients. And then we have our group consultation where you have the opportunity to get some feedback about your specific clients and some of the things that you're understanding. And then we also have a group chat feature for support in between group sessions. So I kind of call it like a VIP experience. I was trying to figure out a way to get some really solid support while you're learning how to do play therapy and develop your skills and get rid of your imposter syndrome. So if you are interested in Play Therapy Academy, then you can pop over to my website at rhplaytherapytraining.com. You'll want to click on the supervision page and look for Play Therapy Academy. We will also post the link for Play Therapy Academy in the comments. And if you feel like it's something you want to explore, then schedule a 30-minute video call with me. It's a free video call to talk about play therapy. How can it help? Play Therapy Academy, see how it can help you. So if you're interested, just go ahead and schedule a 30-minute video call. If you're on the website, then you can click on supervision page. You'll be able to see the schedule a 30-minute video call with me. We'll also put a link in the comments so that you can just schedule a video call with me. It's 30 minutes. Also, just kind of a heads up, next week I will have a holiday kind of flash sale on documentation, which is going to include case conceptualization, treatment planning, and progress notes. So heads up, that's next week. You probably want to stay tuned for that. I'm going to do that course documentation bundle sale. If you're not interested in that, and maybe you just want the case conceptualization course, then pop over to my website and look on the courses page. You'll be able to find all the courses I have on there. So go check out my website, schedule a video call if you're interested in Play Therapy Academy, and I will see you next week. Bye for now.